Hello everyone and welcome to Inside Healthcare. With summer in full swing and lake temperatures finally warming up, many of us are finding ourselves heading to the beach or local pools. Washington County Department of Public Health and Environment wants everyone to stay safe this summer, so they're advising everyone to avoid shallow, warm waters at the lakes, at the rivers, at the ponds. These warm waters can contain a very small parasite called a Naegleria. This parasite enters the human body through the nose and quickly makes its way to the brain. Last summer, it took the life of a very young Minnesota child. Symptoms may occur within 1 to 7 days and starts with a headache, fever, nausea, vomiting, and stiff neck. For more information about Naegleria and other water illnesses, recreational illnesses, contact the Washington County Department of Public Health and Environment at 651-430-6655. Again, that number is 651-430-6655. Joining us now to talk about what doctors are seeing in the emergency room, as well as an exciting new community program that's helping to save lives. We're pleased to have with us Dr. Pete Tange. He's an emergency physician at St. John's Hospital and also the EMS medical director at the city of Maplewood. Thank you for being with us.
Thanks for having me.
So the summer, I mean, it seems like it's only just started, but what are you seeing already in the emergency department?
The normal summer injuries. We are trading our skiing and skating issues for our biking and being outside problems. We had a little flurry of tick activity earlier in I guess it technically was our summer, but it still felt like our spring.
So you were seeing some Lyme disease even?
Lyme and other people worried about tick bites and other skin infections.
We were just talking about some of the symptoms of the Naegleria. What about like for tick? What would be some of those symptoms? And when should they go to the emergency department?
Yeah, I think it's a good question. I think for any time someone's concerned, you know, the emergency departments, that's what we're there for, is to try to help address people's fear and anxiety and help them with their health. I think it's rare that a tick illness is life-threatening. Later on, there can be some life-threatening problems that we end up attributing to a wood tick, deer tick infection. That can be some heart-related problems, but more often it's that people notice a bite on notice a wood tick or notice a rash that they're worried is related to a wood tick or deer tick, and at that point, if it's worth a visit to your doctor. Especially if it looks like the rash is spreading or that there's an infection.
And are you supposed to look for a bullseye kind of a rash?
That's the common rash that people associate with Lyme. So if you see that, but there's other causes for that as well, and the doctor will talk to you and help figure out what is your risk factors for tick illness. And then we have different antibiotics that we can use if needed, or tests that we can do.
I know I was on the golf course yesterday, very hot and humid, and my colleague, I was a little worried about her. She was saying how, she just started not feeling so good, and I was worried about heat exhaustion or heat stroke or anything.
Yeah, as we've kind of jumped into the summer now and the humidity and the high temperatures, I think that's something to be aware of. Risk factors for heat illness include somewhat, extremes of ages, if certain medications, anything that predisposes you to becoming dehydrated. And I think it's just paying attention to your body. So if you're starting to feel unwell and you're in an activity, to stop that. And
that's what we ended up doing. We only played a few holes instead of doing the full 9 that we typically would do.
Yeah, and I think it helps. It's nice that you were looking out for your friend and kind of taking care of each other. This concept of if you're thirsty, drinking, to make sure you stay hydrated. And then I think to me the part that I try to remember or try to educate my patients on is if you're on a new medication or you're on a medication that is a diuretic or something for high blood pressure, to check with your pharmacist and see if that changes your ability to tolerate heat.
Oh, really? That can play a role, huh? Also, St. John's Hospital is a level 3 trauma center. What does that mean? And when should people be coming there, should go to St. John's versus perhaps some other facility? Or
yeah, so the trauma designation is part of a wider state initiative to make sure that patients go to the right place and have the right resources meet their needs. A lot of times that decision is fairly automated, and for the EMS providers, for our paramedics, they have pretty strict rules about who goes where, and that's based on the type of injuries that you have, some of the other parameters that we check. In terms of the individual, if you're trying to decide what trauma center to go to, I would say if you need to make that decision, you should probably be calling 911, and then the paramedics will make that decision. But essentially, St. John's, all the emergency departments, we're able to handle any trauma, whether it's a splinter in your finger or a fish hook, all the way to a severe head injury and multi-system trauma. We can stabilize and care for anybody initially, and then once you're at the emergency department, we'll make other decisions about where, if you need to stay in the hospital, which hospital you stay at.
And with a telestroke, a telecommunications medical thing that you actually, neurosurgeons at another location can examine a patient at the St. John's Emergency Department who may exhibit stroke symptoms?
Yeah, so that's a really exciting use of technology, and we rely right now on our telestroke to help interface with our stroke neurologists. So they're not neurosurgeons, they're actually neurologists. They work out of St. Joseph's Hospital. They provide that service to a number of hospitals, including St. John's. From my perspective, it's a great way to get an expert opinion in right away so I can focus on the emergency aspects, meaning making sure someone's breathing okay, that they're getting the test done in a very fast manner, and then almost contemporaneously have an expert who can help with the nuances of deciding if there's a tweak to a specific test or interpreting that test with me and then making treatment decisions. It's really an exciting way to work, and I think holds a lot of promise for future care, where we will be able to interface more and more via video versus the phone.
And it's in real time. I mean, the patient can see the doctor can see the patient on a monitor. And
yeah. I'm of the age where it always brings to mind a little bit of Max Headroom, where you have that kind of face on the screen. But it's really, it is a totally different dynamic. I mean, as you know, working in video versus radio, where it's so much different to talk face to face and be able to see the specialist, have the conversation in front of our patient, have the neurologist be able to pick up on those non-visual clues or get their own impression of how things look at the same time that they're hearing me speak and the patient speak and the family speak. It's been really
life-saving?
Yeah, life-saving. I think brain-saving is probably even a more accurate term, because with stroke, it's so important. Every second equals brain cells, and not just a few, but lots.
Wow.
So what we really are trying to do is not waste any time while we're trying to determine if the patient's having a stroke, the person's having a stroke, and if there's specific treatments that are time sensitive. So a workup that maybe 5 years ago took me 3 hours to do, which at that time felt like very fast to me, because 10 years it took, 10
3
years
minutes.
ago it took, well, 10 years it would take 8 hours to do. I could do it in 3 hours 5 years ago, and now we can do it in 60 minutes based on the different ways that we're, telestroke and a lot of other changes that we're doing to try to shave minutes and seconds off of people's evaluations.
Wow,
it's exciting.
amazing. So any final comments as far as like emergency department with summer injuries or illnesses? What advice would you have for our viewers that might be watching?
I think, for me, the perfect emergency department shift would be where no one gets hurt, no one gets sick, and I am sitting around helping clean the department. But the fact is that we're there for when people get injured, and that happens despite people's best intentions. The key thing's prevention. So wearing your sunscreen, wearing your insect repellent, wearing your seatbelt, not texting and driving, wearing your bike helmet, looking out for each other. So if you see, something like the story you gave, where maybe you noticed your friend didn't seem like they were doing okay, and checking in with them. that prevention's so important. And then having some basic first aid supplies, so if you do have a cut, you can take care of that. And
All right.
yeah.
So in the lead-in, I was talking about that you're the EMS medical director for the city of Maplewood. And in that role, you're working on an exciting community program. Why don't you tell us about that?
Yeah, so if you think I was excited about stroke, now you might have to cut me off, because this next part's really important. You know, Maplewood EMS, and actually all the EMS within the Twin Cities in Minnesota, we really have a very good EMS system. Through the University of Minnesota, there's a Minnesota Resuscitation Consortium, and they've been really instrumental in trying to advance some of the care that we provide across Minnesota. Maplewood's participating in that, and it's called, the name we give it is Take Heart. But what we found is, again, to go back, let's say 5 years or 10 years, or I've worked in EMS for 22 years, and when people would have cardiac arrest, there'd be a lot of
Standing around looking?
well, there's that on the public side. I think from a provider side, there's a lot of really, it's high energy, high stress. There's lots that we're trying to do. It's very rewarding and dramatic when you're able to save someone's life. But I think there was a sense 10 years ago that, boy, CPR is not really that successful. You know, if someone's heart stops, that's kind of, there's some people we can save, but most people we can't.
Really?
I think that that paradigm is changing now as we learn more and study more and develop other interventions. We're learning that actually CPR is not, if someone's heart stopped, that's not hopeless. There's some interventions that we can do that can have really profound effects and get people back to living a normal life, even though they were, you know, quote, dead for a period of time. I think we used to think, oh, if your heart stops, you're dead. But now I think that's becoming more of a gray zone where if your heart stops, we have 10 minutes or so to get that restarted.
That much time?
Yeah, and I think we used to think, oh, you have 3 minutes, and if you don't, then you're dead, your brain's dead. But I think we're starting to learn that it depends, you know, there's all these variations to it and variables. And we've gotten very good on the EMS side of addressing our variables. So we have automated CPR machines, we have advanced ways of helping people breathe to try to maximize the blood flow to the brain and minimize other harm. We have a team approach, standard communications, a very elegant response to that. In the hospital, we have interventions where we're cooling people. We call it therapeutic hypothermia.
Right, and that's been really successful in preserving life and...
Yep, and getting people, you know, our main goal is to get the heart started, but actually we're taking a bigger picture and say, we want to start your heart, but what we want to do is get you back to hosting your TV show, to being a doctor, to taking care of your children, to your grandchildren. So we want people to come back to the way they were. And so the hospital's figuring it out, EMS is figuring it out, and then the key part really is getting the public response. Because even if we call 911 right now, with a great response system in place, it's going to be 3-4 minutes before someone arrives. So we need to make sure those 3 or 4 minutes that whatever we can be doing, we're doing to help that person who's suffered sudden cardiac death. So when I took CPR, you know, in high school, it was kind of a big, long class. It was very strict. You had to follow the specific rules. You had to give breaths.
And research now shows that it's just as effective or more effective without doing the mouth-to-mouth and just doing the compressions?
The way I understand it is more that the breaths are not that important initially. That for a healthy, you know, for a person whose heart's just stopped, we have enough oxygen reserve to last for more than a couple of minutes.
Okay.
But the key thing is we need to get the blood flowing back through the body to the brain, and then more importantly to the heart muscles. So this is fascinating stuff,
Wow.
like all the cellular changes that are happening. And I won't.
Oh, I love all that though. It's interesting.
It's, you know, it's almost mind-blowing in some respects where, you know, I went through medical school, learned about all these things, and now relearning about how the mitochondria are working, the energy stores. So what we want is for the public to learn and commit to doing CPR for this first couple minutes so that the heart's still getting some blood, some oxygen. It's not using up all of its energy supplies. And then when we arrive as EMS and professional rescuers, we're able to do our interventions, and those interventions then work better on a heart that's been kept alive with CPR.
Well, great. So we're going to take a short break here, and when we come back, you're going to show me how simple and easy it is to do the CPR.
It's very exciting. It'll
All
be
right.
good.
We'll be right back. Stay with us.
Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
And welcome back to Inside Healthcare. Joining us again is Dr. Pete Tangy with St. John's Hospital and the EMS Medical Director for the City of Maplewood. And you're going to demonstrate, you have this program, exciting program, trying to encourage everyone in the community to know how to do basic CPR to save a life.
Yep.
And you're going to show me how easy it is to do it.
Yep, we're going to do it. It'll be very easy. So key things are basically, hopefully, and by all likelihood, you'll never need to do CPR. It's very unlikely you'll need to. But if you do need to do it, it's probably going to be on someone in your family or someone that you know.
So stay calm.
Yep, so stay calm, and people, when it's serious, the gravity brings calmness for most people. If someone collapses, you want to first call for help. So that's the most important thing. So if it was you and I together right now and I collapsed, you'd go call for help. Then you'd come back and check to see if I'm responsive. If you recall the old CPR, it was, are you okay? And then check for a pulse. All that we do now is, are you okay? Are you okay? And if they don't respond, you do a quick pulse check if you remember how, and that's just feeling on the neck. But if you don't feel a pulse, or they look like after a couple of 10 seconds, 30
Coloring
seconds,
start changing.
You don't feel a pulse, then you just start CPR.
Okay.
And all to do that is you can open up the shirt if that's helpful, or you can even do it through the shirt. Just feel where the ribs basically meet in the center of the chest. For most people, it's right about between the nipples.
And you can actually feel the ribs?
Yep, on this one you can kind of feel where it is, but hands on the chest and shoulders over, and you want to push about 2 inches down, and you want to do it about 100 times a minute. If you have a musical ability, you can sing to yourself the song Staying Alive. I'm not musical enough to do that, but let's see you try that.
So I'm assuming it would be right here?
Yep.
Not quite with the pressure that you did.
But you want to go deep. So most people don't go deep enough and don't go fast enough.
Okay.
You're doing a good job by bringing your hands up off the chest all the way.
Okay.
And so if you can do that a little bit faster. And I think another rule is you probably can't go too fast and you can't go too deep. So, and by doing that, you'll get tired after a couple minutes. But that couple minutes is going to be crucial to helping that person be in the best position for us when we arrive as professional rescuers. So, and if you have another person, if you change about every minute, that helps. And then if you stay on the phone, the dispatchers, the people who answer the phone, can help coach you through things.
Maybe put it on speaker or something if you have time to do that.
Yep, they can help coach you through things. This is hands only, so you don't have to worry about rescue breathing, or you don't have to keep count of how many times you push before you give a breath.
Just do it as long as you can and take a break and switch off or something.
Yep, and we really want to minimize breaks between, so keep doing it as long as you can. And once the fire department and paramedics are there, they'll take over.
So you only really have to do it for about 3 minutes or so.
3 to 4 minutes.
Sounds like a long time, though.
It's really long if you're scared, if it's someone you love, and this is a workout. This is a sprint.
Yeah, I can tell.
For 4 minutes. So, but it's really important. If it ends up, hopefully no one will ever have to do this, but we really want people to do it if they need it. Even if you just poop out after 3 minutes, that 3 minutes is still better than nothing. So please, you can't hurt someone who's in cardiac arrest. They need that CPR. We really need the public to do their part so we can do our part and help more people survive.
So if someone wants to take the have you come or someone else come to do the Take Heart? How does that work?
Yeah, what we're trying to focus on is group training. So if you have a group that's interested, we'll put a number up on the screen.
Okay.
It's for the Maplewood EMS Chief Mike Mondor. He'll coordinate our staff to come and do a group presentation, and then watch the news and newspapers for some announcements about public training, where if it's just a couple people, we'll do some classes at different sites. So.
Well, great information. Really a pleasure to have you with us. Glad you could join us.
Thanks so much for having me. This is really important. If there's any questions too, not just about the class, don't hesitate to call Chief Mondor.
Sounds great. So, and then still ahead, we're going to be talking about some healthy tips for you and your family this summer. So stay with us, everyone.
Thanks, Jody.
Thank you.
Good job.
The smallest moments can have the biggest impact on a child's life. Take time to be a dad today. Call or visit fatherhood.gov to learn more.
Welcome back to Inside Healthcare, everyone. It seems like we're all so busy during the summer months, grabbing our meals on the run or not taking time for ourselves. Here to talk about how to keep you happy and healthy during the summer dog days of summer. We're pleased to have with us Nora Larson from Health East Ways to Wellness. Thank you for being with us. And she is a life coach. Maybe we can start off with that. What is a coach? What is a life coach?
Sure. So I am a health and wellness coach, and a health and wellness coach is a trained wellness professional who is there to support you and help you in making, creating and designing healthy lifestyle changes. So what does that mean? We work with patients and clients on many different areas of your wellness. So that could include fitness, nutrition, disease management, prevention, weight management, stress mastery, and we're really trained to not just give advice, but to really listen and empower the patient and client and provide resources and accountability to help them make sustainable, healthy lifestyle changes.
And I understand you're really more into the integrative as well, like you want that whole
I personally am, yeah.
mind, body,
yeah,
spirit.
we take a really nice holistic approach to wellness. Yeah.
So we're talking about the summer months. Everyone's really busy. How do we maintain and keep ourselves healthy and happy, not only us, but our family? And we're all so busy right now.
Yeah, absolutely. As I've been listening to my clients and patients this summer and things that are coming up is just what you're talking about, the time and how we really want to cram everything in the summer months, especially in Minnesota, right? We have these 3 months of beautiful weather, and so we want it to be ideally really family focused, and sometimes we can just pack too much into that. And so I've been talking with patients and clients on how to not skimp on that self-care time. So that's one. And then a second one that's been coming up is the idea of embracing the season and really looking at what can you do specific to summer. Again, unique to Minnesota, we have different seasons, so how can we use these seasons to do different things? For example, public pools being open outdoors. If you're a parent, go to the public pool with your child. You can swim some laps. There's a lifeguard there, so your children are safe and you're close by, and you can get some exercise in, and they're there enjoying an outdoor activity as well. So thinking of things that you can do specific to the season that are good for your health as well. Eating, more seasonally the vegetables that we can grow in our gardens this time of the year.
Instead of grabbing the fast food, perhaps food. And
Yeah.
Other kind of tips that you give clients?
Yeah, I do have some. So in terms of not skimping maybe on that self-care time and time for the family too, there's a 3-step process that I've been thinking about and recommending. And one, the first step in that is taking inventory and assessing your commitments and the activities that you and your family have planned this summer. So literally making a list and then looking at that list and asking yourself some real honest questions about that list. What items on this list are, first of all, are the items on this list serving and satisfying you and your family? And if not, maybe some of those can come off the list. So the first step is inventory assessment. Are they serving you and your family? How many items on this list are allowing you time for your spouse or your family time? And how many items on the list are allowing you time to role model that self-care for your family? So then the second step in that is experimenting, allowing yourself to experiment. And what I mean by this is allowing yourself to temporarily let some of these commitments go and engaging the family in this too. Maybe the kids want to let a commitment or activity go as well, especially if the extracurricular activities are just packed in the summer. And I was reading about a study experiment in Virginia where families did this, and they reported, the kids included, that they felt like they were sleeping better, making healthier choices when they were eating, experiencing less stress. So just giving yourself permission to experiment with
That's
letting
a
a couple
tough
of these
one,
go.
though.
It can be temporary. It
Yeah.
is tough. Yeah, it is tough. And then the third step in this process would be to leave that time unscheduled. So to actively not plan anything in this time that you've now created by letting go of a couple of commitments. And you might be surprised at what comes up. Some healthy, fun, spontaneous activities might come up, like going for a walk, cooking together with the family. It just leaves more space for fun and creativity. Another thing you could do with this open time is start to plan a traditional family ritual during that time, or a family activity that you do with this unscheduled time. And just again, you're just experimenting, giving yourself permission to temporarily try this, because that time too to try to keep that unscheduled is going to need to include you practicing saying no maybe a little bit more to some things. And again, that can just be temporary if people are asking you again to join some commitments, to remember that you can say no and that you can say yes again later, but you're just experimenting.
It's
letting
tough to
yourself-
say no, though.
It is tough.
It really is.
tough.
I
Yeah.
know. So how do you get someone like my husband to go out and do a walk with me?
Yeah.
How do you get him encouraged to do that?
Well, you know, maybe there's a couple ideas that come to mind for me. One is maybe walking isn't the activity for him. Maybe there's something else that you two could do together. So maybe asking him what physical activity would he like to do, and maybe you can do you know, something together that both of you like to do together. Otherwise, I think maybe you know, communicating to him that it's something that you would really enjoy doing, and you can see it as being valuable time for the two of you to connect, check in on your day together, while also getting that physical activity. So maybe explaining to him the need that you have for that walk and what you would get out of it too.
We just have a couple of seconds left.
Sure.
So final tips and advice for our viewers out there and how to stay healthy this summer?
Yeah, you know, I think I'll just review that three-step process of trying not to skimp on that self-care and family time, quality family time, and that would be to, one, take inventory and assess your list of commitments and activities, and be honest about those questions that you're asking yourself about each commitment, and two, experiment. Give yourself permission to experiment with letting go of a couple of those commitments. You can come back to them, but just experiment with that. And the third step would be that unscheduled time, leaving that time unscheduled for you to enjoy things with yourself and your family.
And if someone wants some more information or wants to contact you, how do they go about doing that?
I think that the contact information is going to be available, but also you can just call us at Ways to Wellness directly, 651-232-1926.
Well, Nora Larson, thank you for being with us. It was a pleasure. Great information. And
Thank you so
come
much.
back again.
I would love to.
All right,
Thanks.
thanks. And we'd like to thank you for joining us. We hope you'll join us again on Inside Healthcare. We'll see you then, everyone. Thank you.
Thank you.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.
Now it's time for This Week in Bad Stats.
Bad stats?
Horrible stats. Here goes. 132.
That's how many batters struck out 4 times in one game last season.
Wow, very good. Here's a tough one, though. 3 and 4.
No idea.
That's how many kids witness bullying. 3 out of 4.
That's not a good stat.
No, it's not, but it can change. Kids want to help, but they don't know how. Visit stopbullying.gov and give them the tools they need to help prevent bullying.
There are plenty of safe ways kids can help at stopbullying.gov.